Last year, I opened the chest of a 67-year-old man whose arteries looked exactly like concrete pipes. I want you to really visualize that for a second. Not soft, pulsing tissue, but rigid, gray, calcified tubes. This man was on 4 separate blood pressure medications. He was taking his pills every morning and every night. He wasn't lazy. He wasn't ignoring his health. He was doing every single thing his doctors told him to do, and yet, there he was, lying on my operating table under the bright surgical lights. But here is what nobody told him, and what I am going to tell you today, because the answer was sitting in his kitchen the entire time. 5 simple things. No new prescriptions, no expensive gadgets, no side effects. Just food working the way food was always meant to work. Stay with me, because by the end of this video, you are going to know exactly what to do starting tonight. Let me explain something they don't always have time to tell you at the doctor's office. After you cross the age of 60, your blood pressure doesn't just go up because of stress or salt. Something much deeper is happening inside your cardiovascular system. Think of your blood vessels like a garden hose. When you are young, that hose is brand new and flexible. It stretches easily. It absorbs the pressure of the water. It handles the flow perfectly. But as you age, the walls of those vessels start to stiffen. They lose their elasticity. And we all know that a rigid, old hose cannot handle the same pressure a flexible one can. That is when things start to go dangerously wrong. Now, this is deeply personal for me. I am Dr. Ben, and I have spent 30 years as a cardiac surgeon. I have held actual human hearts in my hands. I have repaired arteries that looked like they belonged in someone 20 years older than the patient on the table. And every single time, I ask myself the same question. How did it get this far? The answer, more often than not, is inflammation. Chronic, silent, slow-burning inflammation in the walls of the blood vessels. You do not feel it. There is no obvious symptom like a fever or a rash, but day after day, year after year, it quietly stiffens and narrows those vessels. Your heart then has to work harder and harder just to push blood through a smaller and tighter space. This is why food matters so much. What you eat 3 times a day is either fighting that fire of inflammation or it is feeding it. Every single meal is a decision your body makes about your blood pressure. Most people don't realize this because our medical system is built on reactive care, not proactive nourishment. I want to be very clear. I am not telling you to replace your medication, but I am giving your body 5 powerful tools that work alongside whatever your doctor has prescribed, tools that, in many cases I have seen personally, make a dramatic difference within days. Are you ready? Let's start with the first one. Here is a question for you. When you sit down for dinner tonight, what do you reach for first? If you are like most people, it is the bread, the potatoes, or maybe a bite of the main protein. I want you to try something different, something that sounds almost too simple to be real. Eat your vegetables first. Before anything else touches your tongue, finish the greens on your plate. Every single meal. Now, I know what you are thinking. That is your big secret. But hear me out on the science. When you eat vegetables first, the fiber in those vegetables forms a kind of physical mesh in your stomach. It creates a barrier, and what that barrier does is remarkable. It dramatically slows down how fast sugar from the rest of your meal enters your bloodstream. Why does that matter for your pressure? Because every time your blood sugar spikes sharply after a meal, your body releases a flood of insulin. That insulin surge causes your blood vessels to constrict and tighten. Right there at the dinner table, your pressure is going up and you have no idea it's happening. I've had patients who changed nothing else, same food, same portions, but just by eating vegetables first, their post-meal readings dropped noticeably within 2 weeks. One of my patients, a retired teacher, called it the easiest thing she had ever done for her health. So tonight, before you touch the rice or the bread, finish those greens first. Now let's talk about something that has been sitting in your pantry possibly for years doing nothing. Apple cider vinegar. 1 to 2 tablespoons in a large glass of water with every meal. That is it. I can already hear the skepticism, and honestly, good. Healthy skepticism keeps us from falling for nonsense. But let me show you why this works. The active ingredient here is acetic acid. Acetic acid improves insulin sensitivity, meaning it blunts those spikes that squeeze your blood vessels. But more importantly, it stimulates the production of nitric oxide in your vessel walls. Nitric oxide is your body's natural vasodilator. It tells your arteries to relax and open up. It is essentially doing what an entire class of expensive blood pressure medications tries to do, but for about $3 a bottle. Just remember, never drink it straight. Always dilute it in at least 8 ounces of water to protect your teeth and throat. Next, I want to ask you, do you check your blood pressure in the morning? Most people do, but almost nobody talks about what happens while you are asleep. For many people over 60, pressure doesn't drop the way it should at night. This is called nocturnal hypertension. While you are lying there unaware, your heart is working overtime and your arteries are under massive stress. This is linked to a much higher risk of stroke. So, what do walnuts have to do with this? A lot. About 30 grams of walnuts, roughly 14 halves, eaten 30 minutes before bed, has been shown to reduce nighttime blood pressure. Walnuts contain alpha-linolenic acid, melatonin, and L-arginine. Together, these work to relax the vessel walls and support that natural nighttime pressure drop your body is supposed to make. Think of it as a gentle signal to your cardiovascular system to stand down and rest. Now, let's look at a flower, a deep red flower used in traditional medicine for centuries. Hibiscus. 3 cups of hibiscus tea a day. Modern cardiology has finally caught up with this. Hibiscus contains anthocyanins that act on your blood vessels in a way that is strikingly similar to ACE inhibitors. It blocks the enzyme that causes constriction without the dry cough side effect so many patients complain about with pills. A study in the Journal of Nutrition found that daily hibiscus tea reduced systolic pressure by 7 points. That is a clinically significant result that makes surgeons like me take notice. Drink it hot or cold, but keep the sugar out of it. Finally, I want you to walk to your kitchen and look at your oils. This might be the most important part of this video. Most cooking oils like canola, soybean, and corn oil are extremely high in omega-6 fatty acids. Today, the average person consumes 20 times more omega-6 than omega-3. This imbalance drives that chronic systemic inflammation I mentioned earlier. Every time you cook with these refined oils, you are adding fuel to the fire in your arteries. Furthermore, these oils are unstable. They oxidize at high heat into toxic compounds. What should you use instead? Extra virgin olive oil for dressings and light cooking, and real butter for higher heat. I know you were told butter was bad 30 years ago. I heard it too. But the science has moved on. As a surgeon who has seen the damage firsthand, the evidence points to inflammation as the real enemy, not natural fats. Replace those seed oils. That one change alone over a few months can transform your inflammatory markers. I understand if this sounds too simple. I used to think the same. But 30 years of repairing hearts has taught me that the body isn't looking for complexity. It's looking for the right conditions to heal itself. The man I mentioned at the start, the one with the concrete arteries, followed these 5 steps. 6 months later, his doctor reduced his meds from 4 to 2. He looked 10 years younger because his body finally had the tools it needed. You are sitting at your kitchen table right now, and you have everything you need to start tonight. Pick just one of these 5 things and do it today. Sustainable change comes from one small decision repeated consistently. Your blood vessels are remarkably responsive. Give them the right environment, and they will respond. If this information helped you or someone you love, please like this video and leave a comment below. I'd love to know which of these 5 tips you're going to try first. Share this with your friends and family, because there are people in your life who need this information right now. And if you haven't already, make sure to subscribe and turn that bell button on so you never miss these evidence-based health secrets. Take care of your heart. It has been working for you every minute of your life. It deserves this. Remember, this is general information and not a replacement for medical care. Always talk to your doctor before changing your routine. Take care.